Medicine's subject is fundamentally a common good. What we all have most in common, our biological nature and its finitude. There is no physician who can claim to own medicine. Even a Nobel laureate in medicine has created only an infinitesimally small fraction of the knowledge that he or she can put to the service of the sick. Now, in medical schools, we don't ask those patients who volunteer for our students to practice physical diagnosis, or those who volunteer as subjects in our research projects, or those who donate their bodies for anatomical dissection, please give us your body at no cost so that we can learn from you and in turn sell it back to your grandchildren at the highest price the market will bear, right? We ask them to contribute instead to a common good to which we ourselves are pledged, the healing of the sick. The goal of medicine, its telos, in its aim, is to help our fellow human beings to flourish as the kinds of things they are in and through the restoration or preservation or amelioration of human biological dysfunction, the restoration of right relationship in this sense. We help our fellow human beings to flourish as the kinds of things that they are by attending to the biological aspects of their nature. And this goal is so fundamental that it's of more than merits, I think, being considered something special among the tasks that any human being could set for himself or herself. And thus, I think the task of medicine is worthy of being called a spiritual discipline. Society also has a critical interest in having a cadre of physicians who consider themselves called to this kind of work. The basic idea of a vocation carries with it the idea of being called to service. For instance, I'm sure many of you in this room are called to service in the ministry. This is service to a common good. Given a choice between two equally technically competent physicians, one of whom considers the work a calling and the other a job, which are you likely to pick? The sociologists Robert Bellah and William Sullivan have written, in fact, that the notion of a vocation is, quote, the essential element that keeps the idea of a profession from degrading into a merely private career, unquote. The idea of medicine as a spiritual discipline then entails the idea that medicine is somehow an act of faith in something greater than oneself, in something that is at least in that sense transcendent. And this transcendence, that at least transcends you as a practitioner, something you don't own, something that you can't do by yourself, that's bigger than you, is at the heart of what medicine does. And the need that medicine addresses, the need for absolute healing, for absolute restoration of right relationship, is incalculably large and impossible to provide. Medicine is, in the end, a finite craft that addresses an infinite need. The need for healing is infinite. It's infinite. Medicine is also universal in its scientific aspect, and yet it is artfully practiced by and for only particular individuals. Medicine is, on the one hand, an objective enterprise, and yet it is directed towards the service of the subjective experiences of sickness and injury. Medicine is thus intrinsically paradoxical, right? It is finite but infinite, universal yet particular, objective yet subjective. And plunging oneself headfirst into these paradoxes as a physician or nurse must be an act of faith in the mystery of the human. Now, the idea of a call to healthcare as a vocation might seem like a challenging idea in a culture as pluralistic as our own, but I want to argue strenuously that this pluralism need not diminish our sense of calling within the healing professions. We have a common calling even if we acknowledge a variety of callers. The philosopher Alasdair MacIntyre has offered us a way to understand how this is possible through his conception of a practice. And here is how he describes that term. And it's a mouthful if you've ever read it in After Virtue, but I'll read it for you. right? By a practice, I am going to mean any coherent and complex form of socially established cooperative human activity through which goods internal to that form of activity are realized in the course of trying to achieve those standards of excellence which are appropriate to and partly definitive of that form of activity, with the result that human powers to achieve excellence and human conceptions of the ends and goods involved are systematically extended. That's MacIntyre. Tough to read, right? But if you can follow that enough, it seems that by MacIntyre's definition, medicine is a practice par excellence. We hold the goods and ends of medicine largely in common. Despite our varying beliefs, we understand one human biology. And our aim, the telos of our practice, is that our fellow human beings should flourish as the kinds of things that they are in and through our efforts to restore, preserve, or ameliorate deviations from the law-like principles and typical development and history that characterize them biologically as the kinds of things that they are. Now, the proper use of the adjective good, whenever you use that word, first requires you to understand something about the word that it modifies. With respect to a knife, for example, we have to know something about what a knife is and what it's for before we can say that a particular knife is good. Right? We could then say, once we know what a knife is, then we can say this is a good knife. It's sharp, it's hard, it's got the proper balance, etc. So too with a human practice like medicine. Once we understand what the goal is, what the telos is of medicine, we can then list the characteristics or virtues that make the healthcare professional good. A good physician, for instance, is competent. A good physician is compassionate. A good physician is a lifelong learner, is trustworthy, is neither rash nor indecisive. A good physician is at least modestly altruistic, willing to put the needs of patients before self-interest. A good physician is dedicated to the common good of suffering human beings. Now, there are other virtues we might want to list, but this short number should suffice to establish that we do have in the healthcare professions a common set of virtues. What the famous Dr. Harvey Cushing, the neurosurgeon, once called a common devotion, a common commitment to live lives that are worthy of the oaths that we take. The oaths that we have professed, by these we have declared ourselves willing to respond to a common calling. We may hear that vocational call through a plurality of voices, but I think we do have a common calling. Now, there are multiple barriers that stand in the way of this call to repersonalize healthcare as a spiritual enterprise. The present economic reconstruction of medicine is surely one of those barriers, and those of you who are in the trenches practicing know this, right? Reconceptualized to be like any other industry, the chief virtue in healthcare is no longer, it seems, compassion or empathy or fidelity to patients. The chief virtue seems to be efficiency, just like in industry. Working in a system in which all the parts are considered interchangeable and any patient can see any physician or nurse about any problem at any time or place, it becomes more difficult to believe that questions about relationship have a transcendent meaning. Working in a system in which financial incentives get reconfigured to make the physician and patient economic rivals, it's hard for either the physician or the patient to feel that their value constitutes the dignity of which Immanuel Kant has written, because for Kant, true dignity is that value that has no price and belongs only to persons. And working in a system in which patient visits have been reduced to 7 minutes, it becomes almost unimaginable that questions of meaning could be addressed. And yet these neglected questions of meaning constitute the spiritual in healthcare. So I think the spirituality of medical practice must begin with a frank acknowledgement of how much the people who are in this for the right reasons are suffering today. Many physicians, I think, long to be able to give the spiritual questions of practice their due. But too many find their efforts thwarted by demands to shorten the time they spend with patients, fill out more forms, refer patients to practitioners they don't even know, and treat them with formulary-approved drugs they've never used before, just because they're cheaper. If we're honest, this spiritual suffering of practitioners has two sources, one internal and one external. The internal one is that scientific reductionism has threatened the spiritual aspects of medicine from within by denying the importance of the transcendent. On the outside, the industrialization of medicine now threatens the spiritual from without by denying the importance as well. And yet, particularly for those of you in the room who are in practice, I want to remind you that no amount of economic transformation can alter the fundamental meaning and value of healthcare, nor can it eradicate the interpersonal nature of the healing relationship that begins when one person feels ill and another highly skilled and socially authorized person reaches out with his or her hand and asks, "How can I help you?" Right? That's what I ask. That's what most doctors will ask. "Hello, Mrs. Smith. How can I help you?" The spirituality of medical practice at the dawn of the 21st century is going to demand of us great virtue. Courage, hope, perseverance, and what Marcel called creative fidelity. Now, it's certainly not easy to be a physician or a nurse or a psychologist today. But when all is said and done, those of us who practice the healing arts always will and still do touch our patients in remarkable ways. And the spiritual meaning of medicine is going to outlast every global budget, every attempt to impose the U.S. managed care model on the world, all Medicare cutbacks, all manner of profiteering at the expense of patients. If spirituality is real, it will be real for times of trial as well as for times of triumph. Money can't buy spirituality, and money won't make it go away.